Dr. Reema Basu completed her medical training at UC Irvine Medical School, followed by an internship and residency at UCI Medical Center. She believes that prevention and early detection are the best medicine.
I think primarily what I try to focus on the most is prevention. I think that's a really important part of pediatrics. And while obviously I love seeing my patients when they're sick and I need to treat them, I also think it's really important to see them when they're well. There's a lot of things during their lifetime. There's a lot of themes in their life that I think follow them in infancy all the way to young adulthood. If I can have any small role in navigating them and helping them lead a healthy lifestyle, that we're on the right track.
Dr. Basu believes her role as a physician extends beyond treating patients when they're sick to helping to maintain their ongoing health and well-being.
Parents play important role in the prevention of childhood diseases such as obesity and diabetes, and we've been seeing that things like that are occurring at a younger age more and more, and I think it might be because of our culture. So I think that parents have to even be that much more vigilant. So when they come into the office, I think it's all about navigating and educating parents and throwing in tips here and there to make it an easy process, or an easier process actually, so that they can instill good habits in their children.
She knows the importance of relating to children on their own level.
So I think that my philosophy of care revolves around making the patients and their parents both feel comfortable. I think that going to the doctor in itself can be very intimidating, and I certainly remember when I was going to the doctor, or when I do go to the doctor, it can be a scary thing. I think one of the best ways to start establishing that comfort is by actively listening to my patients. I think that all of us kind of strive to master the art of listening, and I'm definitely working on it on a daily basis, and I learn from my patients, and you kind of have the luxury to do that.
She believes her role as a physician is larger than simply providing good health care.
You might not know it, but I think that when you come to a doctor's office, you think that the relationship's only with you and the doctor, but it's also with the staff, and it's also with the other resources like the dietitian, the nutritionist, the asthma educator. They all play an active role in your child's health. So it's important that wherever you go or wherever you take your child, that you have access to these resources.
Dr. Reema Basu views her role as much more than that of a healthcare provider. It's being a part of each child's entire support system.
I think if my patients feel that I was there for them at the end of it all, and that I served as a support network for them and their families, and they say to themselves, Dr. Basu was really, truly an advocate for our families and for our health, then I think that I would have had a very successful career.